So I remember I sat down and said Slim is coming. She was just going for a quick break and then definitely should be right back. And guess what? I am here live and direct inside the studio on Top Health Matta this morning with our in-house doctor talking about Dr. Bat. And for a while, as a matter of, I think for like 3 months thereabout, we don't talk about coronavirus. And why we see they talk about and because of, say, every day we get to wake up, we get increase in numbers. The numbers are not decreasing. So until this is eradicated, I don't think we are going to stop because we still need to inform those persons we no believe say e dey. We still need to do awareness, of course, cautions, talk, enlighten people on top of the pandemic. Anyways, doctor is here as always. This time I gave us black and white. I like to just compliment when I see something good. But
Good
doctor,
morning.
you've never disappointed, so it's cool.
Slimmest of them all.
Doctor.
Always looking cute.
Thank you. How you doing, sir? How's the
Yeah,
family?
I'm fine, thank you.
You have the floor.
Yeah. Good morning, viewers at home and around the world. We're happy to be back on today's episode of Health Matta on WAP TV.
Yep.
Today we'll be looking at a topic we started some 8 months ago.
Wow, 8.
Yes, 8 already.
Yee.
We're in the month of August.
That's true, though.
Okay. Precisely, coronavirus pandemic. Otherwise known as COVID-19. Yesterday, the world commemorated Nigeria alongside other nations of the world commemorated World Mask Week. World Mask Week. It's a new initiative that was initiated by WHO and partners. WHO alongside other partners, including, of course, our own NCDC, as well as the Federal Ministry of Health. Now, what is it all about? It's a time to look at how far we have gone with respect to the non-pharmaceutical interventions or protection or protective measures that we require to mitigate further spread or further transmission of COVID-19. Talking about the wearing of face mask. I was looking at the statistics early hours of today, and I discovered that on a global scale, the numbers, the upsurge keeps going up. Every 17 seconds, one individual dies of COVID-19. And in 1 hour, you have about 247 people dying to COVID. That's a rough estimate. As of early hours of this morning, my source is odometer.com. Coronavirus pandemic has affected 19,542,626 persons.
Let's say almost 20 million. Approximately.
Unimaginable.
Globally.
Yes, globally, on a global scale. I'm not sure any of us saw this coming.
No one.
Now, it has also caused over 700,000 deaths globally. 724,075 individuals, human beings, have lost their lives, unfortunately, to this scourge. It's alarming. Suffice also to say that 12,544,638 persons have recovered from this COVID-19. A good number of us that must have been following the COVID-19 pandemic response in Nigeria would have noticed that in the last couple of weeks, in the last 2 weeks precisely, we have had a decline, a steady decline in the number of cases of affected people in Nigeria. And of course, trust Nigerians, we have started making our permutations. Is it that we are beginning to win the battle? Of course, the answer is yes. But we need to do more. That's the essence of advising us. Because if you look at what is going on, people are beginning to lose their guard. And of course, that is not going to help us. I also listened to, earlier in the week, to the DG, Director General of NCDC, when he was asked the same question. What could be responsible? Should it be that Nigeria has been able to flatten the curve? He said, no. The number of factors may have contributed to the declining number of cases that we are seeing in Nigeria. One of the things he said was the fact that the people who have been on these tired legs may beginning to set in. Okay. Beyond that, he also pointed out that the number of labs we have in the country have improved drastically. Talking about molecular laboratories that have the capacity to independently test for COVID-19. As of the last count, we have 62 scattered in various parts of the country. And that is a good positive. I also try to look at the number of people that have been affected in Africa with respect to how far they've gone. Talking about testing capacity for some of our African neighbors. Okay, it is no longer news that the worst hit country in Africa at the moment remains South Africa. South Africa at the moment has a total affectation of 545,476 cases. And they've been able to test 3.1 million, 183,658. Next to South Africa, in terms of the country that has tested more, of course, is no other country than Morocco. They've tested 1,405,159. Next to South Africa, in terms of affectation, is actually Egypt. Egypt has 95,147 infected cases at the moment. And the tests they've done so far are 135,000. Of course, our own Nigeria, our own beloved country, sits at the number 3rd position in Africa with a total affectation of, as of today, 45,687 cases. And in the last 24 hours, we saw 443 new cases. Also, that brings the total number of people that have suffered deaths or that have died, unfortunately, to this scourge to 936. That's just about 1 million. And we are talking about the documented cases. What about the others that probably died, even without
being tested?
Yes, being tested as of that time. And Nigeria also have done 310,729 tests. That's a good one. I think we can comfortably score ourselves a pass mark.
At least.
Yes, we can score ourselves a pass mark on this. Other countries too is Ghana, that is seated at number 4th position. Ghana has done 409,373 tests so far. So we all can see that the numbers are not abating on a global scale. But we are happy to see declining number of cases in the country. I also tried to do a little bit of statistics with respect to Lagos being the epicenter of COVID-19 in Nigeria. I was just trying to do this summation shortly before we came on air. And I realized that the positivity rate so far in Lagos State hovers in the neighborhood of 11.3% to 29.4% in the last 6 days. I will give us the statistics I have here.
Okay.
As of 29th of July, Lagos State was able to do 611 tests. And with that, they discovered 109 new cases, which stands at 17.34% positivity rate. 1st of August, Lagos State was able to test 285 persons, and they discovered 65 new cases. And of course, that gave us a positivity rate of 23%. 2nd of August, Lagos State carried out 277 tests. And with that, we discovered 81 new cases, giving us a positivity rate of 29.24%. 3rd of August, Lagos State tested 403 persons. And with that, they discovered 88 new cases. And that gave us a positivity rate of 22%. On the 4th of August, Lagos State tested 521 persons. And with that, a total number of 59 new cases were discovered. And that gave us a positivity rate of 11.3%. Lastly, 5th of August, the largest tests were done. 930 tests were conducted in Lagos. This includes both the government and the private labs. Of course, we know there are about 7 of them that recently came into the picture. And of course, 137 new cases were discovered, leaving us with a positivity rate of 15%. So you discover that the positivity rate, at least in Lagos, being the epicenter of COVID-19 in Nigeria, hovers between 11.3% to 29.24%. It's also no longer news that Lagos State government, on account of poor bed occupancy, has started closing down some of the isolation centers. As a matter of fact, so far, yes, I want to give us the figures we have at the moment of the people that are currently in isolation center in Lagos. Going by the Lagos State released figure as of 5th of August. Okay, so as of 5th of August, Lagos State has a total confirmed cases of 15,580. Positive cases in isolation, 83 persons. Discharged from isolation, 2,238. Number of people that died in Lagos, unfortunately, 195. Active in community, 1,683. Recovered in the community, 11,381. Total cumulative tests so far done by Lagos State as of 5th of August stands at 66,431. I also would like to point out that recently, Professor Aki Abayomi, the Honorable Commissioner of Lagos State, who has been doing a wonderful job, pointed out about 19 hours ago, he noted that 1,683 active cases in communities are yet to turn up for admission in hashtag COVID-19 Lagos care centers. 1,683 infected individuals are refusing
to turn
up for admission and get treated. And of course, you and I know what that means. These individuals will remain in the community
and keep infecting
people around them. So we need to put on face masks at all times. When you do so, you protect yourself, you protect your family, you protect your friends, you protect others around you. So you protect me, I also protect you. That is what the use of face mask is all about. Not in isolation, alongside other preventive measures, okay, which of course include social distancing, hand washing under running water for at least 20 seconds, the use of sanitizers, hand rub if you're unable to get water anywhere around you. And of course, not forgetting the fact that we all need to ensure that we maintain social distancing at all times. But in places where we're unable to do so, we must find a way of protecting ourselves. Is either you leave such a scene or you advise the people around you. Now, it's a collective responsibility. We all have to assist and help each other.
Yes, sir.
I need to encourage you. You also need to encourage me. And we have to do this with love. Okay? We have had cases of people where people reminded they're not putting on your face mask, and of course, it resulted in exchange of words. Some even go as far as fighting one another. No. The essence is for us to pull through this crisis together. We want to see ourselves alive at the end of it all. So that's the essence of asking us to observe these non-pharmaceutical interventions.
Okay. Doctor, let me just hold you up a bit. So I think it's okay for us to go for our first break. And when we come back, I'll open the phone lines and people can call in to ask your questions or make your contributions. Dr. Matta and myself, they come back.
Health
Health matter na serious matter o. That na why we dey always get Dr. Bat Ufegbuna every Saturday to come teach us and enlighten us on top we health matter. You fit interact with us on top the show or talk to the doctor through we phone numbers wey be 08173147589 and 08105434984. You still fit call us on top with Skype ID wey be WAP TV. You fit also advertise your product and services on top with show wey dey help people. Terms and conditions apply sha o.
Good afternoon, Auntie.
Hello, John. How are you? I see you're not wearing a face mask. Do you know the risk of getting infected with coronavirus is very high when you don't wear a face mask while outside or in public places?
But I'm young and very healthy. I cannot easily be infected with the virus.
Anyone can be affected with coronavirus if not careful. One of the most effective ways to prevent the spread of coronavirus is by wearing face masks. This ensures that persons infected with coronavirus do not easily infect others. You can use any type of mask available to you. Just make sure you clean your hands with alcohol-based sanitizer or with soap under running water before wearing your mask. Cover your mouth and nose with the mask. Avoid touching the mask while using it. If you do, sanitize or wash your hands with soap and water. Replace the mask with a new one once it is damp. To remove the mask, pull it off from behind. Dispose single-use mask immediately in a closed bin. And clean hands with alcohol-based sanitizer or soap under running water.
This message is brought to you by the Adamawa State Ministry of Health in collaboration with UNICEF.
Everyone has to wear a face mask to reduce the spread of COVID-19. Wearing face masks appropriately can help prevent the spread of COVID-19. So the more you wear your face masks, the better. Whether you are on your way to work, the market, or the bus station, always wear a face mask. When an infected person coughs, they spread tiny droplets filled with the virus into the air. Wearing the mask helps to reduce the amount of virus being spread by an infected person. When wearing a face mask, make sure it covers your nose and mouth. You do not wear it on your neck or under your chin. Avoid touching your mask often. Dispose of it hygienically. Face shields will not protect you from COVID-19. Avoid wearing them. If you must, always wear it with a face mask. Take responsibility. This message is brought to you by the Presidential Task Force on COVID-19.
Hello, today I'd like to talk to you about how to wear a non-medical mask, also known as fabric mask. Fabric masks can be used by the general public in areas where there are many people infected with COVID-19 in the community, and physical distancing of at least 1 meter cannot be achieved. There are a wide variety of fabric masks that can be handmade or purchased in a store. They act as a barrier so that you can protect those around you. They should ideally be made of 3 layers of fabric. The outer layer should be a water-resistant fabric. The inner layer should be water-absorbent, and the mid-layer acts as a filter. First, clean your hands with alcohol-based hand rub or soap and water. Pick up your clean mask and inspect it. If it is damaged or dirty, do not wear it. Place the mask on your face, covering your nose, mouth, and chin, making sure there are no gaps between your face and the mask. Do not touch the mask while wearing it to avoid contamination. If you accidentally do, clean your hands. Before touching the mask, clean your hands with alcohol-based hand rub or soap and water. As you remove the mask, lean forward slightly and remove the loops from behind the ears without touching the front of the mask. And don't forget, wash your hands after taking off the mask. Make sure that you have your own mask and do not share it with anyone. If your fabric mask is not soiled or wet and you need to reuse it, you can store it in a clean plastic resealable bag such as this one. However, if it is dirty, do not use it. Wash it with soap and water, preferably at high temperatures after each day of use. Remember, a mask alone cannot protect you from COVID-19. It must be combined with protective measures, including maintaining at least 1 meter distance from others and washing your hands frequently. Stay safe and help prevent the spread of COVID-19.
She don't actually talk she say mask alone no fit prevent us from COVID-19. We guys make sure we adopt all of the other measures so we know. We need to stay safe, like she says. And of course, she will also take us through the journey of how to wear our face mask. Especially those material ones, the ones they tell us the airport so. It is very, very important. A whole lot has been said by Dr. Matta, and guess what? She got more from where all of that they come from. They talk about coronavirus pandemic this morning. I will open my own lines or the phone numbers so that you can feel free to call us, because even me, I don't write down some questions where I want to ask Dr. Matta this morning. So if you did in my shoes, you say get questions, or you see they confused, or you see no believe and you want someone to convince you, just dial the numbers on your screen 081-054-34985 for 0817-314-7589. Yes, feel free to add us up on Skype at WAP TV. Just search for us, you see us. I would also like to see your faces this morning. Now, Doctor, I get like 3 questions, but I'll just take my time to ask them one by one. The first one now, the time you were talking about the declining, say the numbers my worms are making noise. The numbers, they don't decrease, which I totally agree with, because I remember when this whole thing been started, like we wake up every day having like 500 persons infected, 300 and something infected. But these days we get to like 78, 100 and, gradually. Now I want to ask, as a doctor and as a citizen, what do you think is really responsible? Is it that shouldn't based on facts, okay, we don't get more testing centers, or people are beginning to obey the measures put on ground, or we've developed a tick hormone, to that effect? What is really responsible for the numbers?
Thank you very much. Thank you very much. I want to approach it from a number of perspectives. Number one, I want to approach it from a scientific perspective. Okay. Now, I must also point out that Africa has a young population. Okay. When you compare Africa to other continents of the world, you discover that we have a young population. Okay, life expectancy in this part of the world is said to be about 55 years or 55.7 years or thereabout. Approximately 55 years. Now, what that means is that majority of our population, they are in this age bracket. Most of them are youths. Okay, so we do know, it is an established scientific fact that COVID-19 are known to affect vulnerable group of people much more than others in the population. And of course, this will include people who are advanced in age, the elderly, as well as people who have other comorbidities and underlying sickness. So Africa, having a young population, you're likely to see more of young people who will be able to ward off the infections. Okay, who may not have a lot of baggages in terms of underlying illness. That should be one factor. Now, the second one I also want us to look at is the fact that in the US, for instance, it was discovered that part of what contributed to the disproportionate fatalities that were witnessed among some certain people in the US, especially people of color, black, and of course, some other population in the US, they discovered that this set of people were found to have vitamin D deficiency. And of course, a good number of us must have known that we have abundance of vitamin D when we come out on the sun.
Yes.
So our body system will generate loss of vitamin D when we come out in early morning sun. But some other countries, okay, may not have this opportunity as you and I have in this part of the world. Okay, so vitamin D deficiency are not likely to be found in large quantities in our population. So that on its own could be another reason. Okay? Now, also...
Okay, Doctor, I'm actually not done with my questions. Okay, so I also want to know, are there other promising drugs? I know we've heard so much about chloroquine and all of that. I know researches are being made at the moment, So are there other promising drugs outside chloroquine that, at least gives us a brighter...
I'll tackle that question, but let me quickly add to your first question that it's not gainsaying the fact that the more we test, the more we will discover. The statistics that I read out from Lagos State in the last 6 days will justify this fact. If we test more, we are likely to discover more. Look at the day that Lagos State was able to test 930 persons. Of course, they discovered what appeared to be the highest in the last 6 days. 137 new cases were discovered. So the more we test, the more we'll be able to discover. So the less we test, the less the numbers that we'll be able to find out. Of course, so that nobody should be carried away with the declining figures. Okay, so they are not as a lot of us are actually beginning to put permutations over the numbers that we are beginning to win the battle. Yes, we are making progress, but we are not yet there. I must also point that out. Now, coming back to the question that you asked on drugs, apart from the hydroxychloroquine with all the controversies associated with it, there are two very promising drugs that are today being used, in COVID-19, for COVID-19 patients that are severely sick or that are hospitalized. Let me use for hospitalized COVID-19 patients. Now, let me also say at this point that greater percentage of people who will get infected with COVID-19, 80 to 85% of people who get infected with COVID-19 may not even have to visit any hospital. Of course, what that means is that they may present with little or just mild symptoms. So they can afford to recover by themselves, even in their houses. But the danger is that the fact that if they remain in the house, they will keep transmitting it to others. That is why it is important that those of us who are infected and we are still hiding in the community should please come out and help us to fight this scourge. Okay. Now, talking about the drugs that are showing promising results, one of them is dexamethasone. Okay. It has been proven. It has given a number of studies that were carried out in several places in the world have actually showed that this drug is efficacious. Okay, in handling severely infected individuals, not for anybody. People who have little or no symptoms are encouraged not to take such drugs. Okay, now the second one is remdesivir. Now that remdesivir is not widely available. Now that drug was a drug that was made about some 4 years ago for Ebola. So a lot of us are calling it Ebola drug. Okay, the company that made it is Gilead Pharmaceuticals. Okay, that drug has also shown a good number of encouraging results for people who are severely sick where it has been used. But these drugs are pretty expensive, unlike the dexamethasone that we mentioned a while ago. For instance, the drug maker in the US are charging patients $3,120 per course. That's for the one that will last for you to finish treating a patient. And of course, the injection goes for $520 per vial of remdesivir. It's a pretty expensive injection. It's not easily available. So that those of us who may think, yes, the drugs are coming, they are not yet include the face masks that we have been singing.
Social distancing,
washing our hands, as well as avoid touching our face, our eyes, and our nose at all times. Thank you very much.
Thank you very much, sir. I still have one more, but I'll just allow you if I ask, because I actually wanted to know the update on vaccine. I don't know what's the update on vaccine. At least now you've talked about drugs. Do we have vaccine coming up, and how soon is it going to be? We just want to know.
Yeah, thank you very much. Yeah, not just you, a good number of us, even healthcare professionals, we all equally want to know what is going on. Now, talking about vaccine, The last WHO update I saw said that about 115, that WHO is currently monitoring about 150 vaccine candidates that are undergoing different stages of research around the world. Okay, but 15 of them have got into an advanced stage. 3 of them have gotten to phase 3, okay, of clinical trials. Phase 3 of clinical trials are the stage where it can be used for tens of thousands of people in the population. And as we speak, I'm proudly going to announce to you that Africa is not left behind.
Oh, good.
South Africa has been actively involved in the trial, in the vaccine trial that are currently ongoing. 2 of the vaccines actually, the one from Oxford University in the UK, and then the one from the Moderna pharmaceutical venture. They've started doing large quantities of human vaccine trials, meaning that a good number of them have actually given the vaccine to close to or more than 10,000 people. And of course, the results have been encouraging. Okay, so with that in mind, a good number of scientific authorities are projecting that before the end of this year, the world may see an efficient vaccine. So the next level of trial will be to concentrate on how efficacious are these vaccines. Will it require just a shot, a jab, or multiple doses? There are some vaccines that when you take the first dose, you still need to take a second dose, otherwise known as booster dose. Would that be the picture? What about safety concerns? Okay, I can tell you that there are a lot of people today, if vaccines are brought to Nigeria today, a good number of people will not want to be involved.
Why?
Now,
everybody wants to be safe.
Now, the reason about that is that there have been a lot of misinformation that has to do with vaccination going on the social media.
Yes.
Okay, a lot of people are beginning to see vaccine as a way of trying to depopulate the world. That is not true. Okay, I can tell you that some of those informations are nothing other than fake news. Gavi Foundation, for instance, have been involved in vaccination of millions and millions of people in the past 2 decades. For over 20 years, they've been saving lives, providing vaccines for measles or what have you. And before now, people didn't know much about them. Okay, but with the coming of the COVID-19 also came, I think a WHO person said we are battling 2 pandemics at the same time. The real one is the COVID-19 pandemic, and of course the infodemics, the one that has to do with fake news. So we should avoid that. If the vaccine comes out today, and it has been confirmed by relevant bodies, someone like me, I will be among the first.
Doctor, we trust you because one of the persons that actually started the campaign on coronavirus. So
that's the much we know about
the vaccine.
I also
let's take Bashir from Ogun. Bashir, good morning. Bashir. Hello, Bashir. Oh, sorry. Please call us back. The numbers are still on the screen, 08105434984 and of course 08173147589. Call the numbers and you can still choose to Skype with us. Definitely would like to see your faces this morning. So Doctor, you're saying something?
Yeah, thank you very much. I was going to point out that I saw a news that was somehow unpalatable to me earlier hours of this morning. The fact that coronavirus has infected 24,000 South African healthcare workers. Okay, the story is actually not different in Nigeria. Okay, so we must commend the efforts of our frontline health workers that are putting their lives on daily basis on harm's way to ensure that people who are down are treated so that they can regain their health and then return to their duty posts. Unfortunately, 24,000 individuals in South Africa have actually caught the virus in the line of their duties. And out of this figure, 181 of them have actually died. It's a sad story. People that are dying as a result of trying to, that is what one can refer to as paying the supreme price. Okay, so I also would like us to look at the areas of transmission. Is important. Now, how are these COVID-19 transmitted from one person to the other? Lately, we were told that there are strong evidence, scientific evidence, that are pointing towards airborne transmission. Now, if you understand what airborne transmission is all about, you will know that there is no reason why you should leave your place of abode and getting into the public space without putting your face mask.
Doctor, but you know when this whole drama started, we used to do face masks, we wear gloves and stuff. But now these days, I think the only thing I see people wear is the mask. They no longer use the gloves. I don't know. Or is it that one is more important than the other?
No, not that one is more important. What has been happening is that the rules keep changing. As more information are made available, as more scientific research results are coming out, the world will keep adjusting to what we have now. Now, what we had against the use of gloves was that it would discourage people from doing hand washing, which is key. Hand washing, for instance, going by some studies that have been carried out, have shown to prevent respiratory infections up to about 17 to 20%. Okay, so when you wear hand gloves, it gives you a false sense of security. You can be using it anyhow. As oftentimes you discover that your mask may be about falling off, and you'll be forced to touch it. Okay? Now, but when you wash your hands, that is a better option. When you keep washing and washing, and in places where you can't wash, you make use of sanitizer. I will have Debayo from Lagos. Good morning, sir.
Hello, good morning, doctor.
Yeah, good morning, my brother.
Okay, I'm enjoying your show, sir.
Thank you very much.
The question I want to ask is that, is it compulsory for someone to use face mask in, maybe someone is the only, you are in your car and you even wind up, is it compulsory for you to use face mask?
No, my brother. The answer is no, but we sometimes do it. I also do it. Sometimes, yes. Now, why I do it?
Because last week when I was going somewhere, I saw a policeman stopping a car and I want to arrest the person for not using face mask. And he's the only person in the car.
Funny enough, I heard that story too.
I think we should correct that impression.
This is not when you guys are more than one. Or
yes. Anybody that is staying alone in his car or driving alone, if the person is infected, he's already infected. If he's uninfected, he's uninfected. Okay? As a matter of fact, except if the person stops the car and steps out of the car, that's when you will start coming in contact with people. But if he's staying in the car, a car that is on motion, whether the glasses are up or down, it doesn't matter. The person is not capable of infecting anyone else. Okay, but sometimes, these are some of the practices that we do even without knowing. I drive almost all the time with face mask because I wear my own religiously.
Regularly.
If I'm leaving my house without face mask, it's as if I'm incomplete. As a matter of fact, I have it in all my vehicles. At any point in time, I wear and I give to people around me who may not have to wear at that point in time. Okay, so it's about developing the culture. But when you're in your car, you don't need to wear it. But if you're putting on one that probably has a respirator,
like
the one I'm putting on, you can breathe. The breathability is close to what you have if you're not putting on a face mask. Okay? But that cannot be said for a number of face masks that are made of thick clothing. Don't forget, when government approved the use of face masks in Nigeria, the outline or the modalities for making face masks did not come with it. Yes. It was much, much later that we were told how to go about it. So a good number of them were made without any form of direction. So you can see people wearing very thick stuff that when you put it on your nose, you will always going to suffocate. That type of face mask, the breathability is compromised. And that accounts for the reason why you see a good number of people lowering their own.
In short, doctor, I was almost asking that. I don't know. What you have to say about it? Because now it's not like a face mask, it's chin mask.
Yes,
that's what
mask.
I see.
Okay, so but my advice is you need to find out which works for you. Okay? Before now, there were advice on people not to use medical face masks, but I don't think any medical person is still talking about now. Graciously too, medical face masks are today being made in Nigeria. Okay? One private organization has gone into production of medical face masks. I see it on the road all the time. it now sells, you can get a medical face mask for as low as 100 naira. So nobody has any reason not to wear. Even if
there are even some fancy ones with
affordability
one like shade.
is very, very affordable. Okay, so it's not a question of affordability anymore. Nobody has any excuse not to wear. Get the medical face mask. The breathability with medical face masks is a lot easier. Not all of them though. N95, that's not the one I'm talking about. I'm talking about the conventional face mask that has sling, not the N95. So of course, a good number of can't even afford to put on because of the challenges that come with it.
Okay, so that you don't hear them. You've heard it from the horse's mouth, from the doctor.
Yeah, thank you.
Okay, let's take, I think you have a Chisom from Kogi. Good morning.
Good morning, Ma.
How are you doing, sir?
I'm fine, thank you. Yeah, please, I want to ask the doctor a question.
Yeah, feel free.
Like, doctor, you're talking of face masks.
Yes.
You know, there are some certain people that are not, what is it called? Their health is not okay, like, they are not fully healthy, and they find it difficult breathing. And putting on face masks might be difficult for them, and maybe their work is not the kind of work that requires them to stay at home, so they must go out to work and earn their living. So, such people, what are the advice do you have for them?
Thank you very much. Thank you very much. Now, I must agree with Chisom. There are some exceptional cases. Okay, sometimes we'll see that in the hospital. Okay, you may have a patient that is having difficulty in breathing or shortness of breath. The person ordinarily, without any form of assistance or obstruction, is struggling to breathe. And then when you now ask such a person to put on a face mask, you further complicate the person's woes. Okay, such people will actually benefit from oxygen supplementation. That will be in a hospital setting, though. Or in some cases, those are the people, depending on the oxygen saturation that you're getting, at least for the healthcare workers that will be monitoring such an individual, it will get to a level they will have to move from oxygen supplementation to ventilator. Now, but I do know that there are a number of people who have asthmatic patients that have challenges putting on face masks. But as a doctor, I can tell you that it is not all the time that people who are asthmatic are going through attacks. Okay, so it's not all the attacks that are going through attacks. It's when they have attacks that they may be faced with such a challenge. But my advice to them is that there are some face masks that have respirator that can help you to improve your breathing. A good number of them will look as if you're breathing without any form of obstruction on your face. Okay, so they should go for those ones. Cloth masks may not be ideal for this set of people. Okay, so one needs to find out what works for him or for her. But not using is not advisable because this category of people are known to be vulnerable set of people in the communities. If they have or pick up the infection, they are likely to come out with worst outcome. Okay, they're likely to be severely hit. Okay, now I was going to talk about ways of transmission of COVID-19. Let us remind ourselves. Now, the transmission could be from animal to human. Okay, early in the pandemic, that was the case that we were told that happened in Wuhan, in Hubei province in China. Okay, but what we now have predominating across the globe is human to human transmission. And how does it work? Yes. How do we transmit this from one person to the other? We've been told that it is airborne. That complicates the matter even the more. Okay, so when we talk, sing, or shout, or sneeze, or cough into the air, for an infected person, the person will end up polluting the environment. So woe betide you if you're within that vicinity and you don't have your face mask. Is a straight entry into your nostrils, into your mouth. Okay, so that is one of the ways. When the person sneezes or coughs, the infected droplets are poured into the atmosphere, are poured into the space in and around the person, and it is made worse when the person is seated in an enclosed space with poor ventilation. Okay, you could have that setting. That is why government is trying to limit mass gathering as much as possible. as much as possible. Okay. Now, this is actually a time that we should begin to reinforce those protective measures. Now that government are beginning to ease the lockdown. Now that we have started flying again. We have started moving from one state to the other. We have started coming in contact with getting into public transport that oftentimes could last for as much as 7 to 8 hours on the road, seated in the vehicle with the same set of people, sometimes air-conditioned vehicle. Okay, so we should encourage each other. Okay, so one of the ways, of course, is through this avenue that I've mentioned. Another way is that the fact that when we sneeze and talk for an infected person, the droplets that leave our mouth could be deposited on hard surfaces around us. Okay, now, if an uninfected person end up touching such a surface and inadvertently touch his or her nose or her eyes, the person can get infected. So that brings us to the fact that we need to constantly disinfect frequently touched surfaces around us. It could be our doorknob in our offices. It could be our car knob. It could be our hand railings where you have staircase. It could be ATM buttons. Okay, name them. So we know all those things. So we need to frequently disinfect our surfaces. I was listening to WHO Director General, Dr. Tedros Adhanom, talking about the face mask challenge. He said that he goes about at all times with 2 items. Number 1 is face mask, and of course, number 2 is sanitizer. And of course, while he was talking, he pulled it out of his pocket. Okay, so we should copy action. We should copy stuffs like that, so that at any point in time we don't have any excuse. Remember, the best form of prevention is always better than cure. Whether chloroquine, remdesivir, or dexamethasone can cure is immaterial.
Better you just preventive.
That is for people who are infected.
Stories that touch.
Okay.
Okay. Chinedu from Abia. Hello, Chinedu. Good morning.
Good morning, ma'am.
How are you doing, sir?
I'm good. Are you?
We are very well. All right, please go on with your question.
Yeah.
Turn down your volume and go on. Hello?
Yeah.
Okay, please go on.
Is there any recommended face mask that one need to put on? Because we have seen a lot of people with several kinds of face masks. So which one is really recommended for us? So that based on what Doctor have just said.
Thank you very much. Thank you very much, my brother. I will approach that question with wisdom. Before now, yes, I know why I said so. Before now, what is advised, okay, by health authorities is that people should wear cloth face mask. People should wear cloth face mask.
That's material.
Materials made of cloth material and or whatnot. Now, I want to say, and I believe so, I may be right or wrong, that the reason why that was done at the initial stage was because medical consumables were more or less scarce commodities at that time. It was difficult for healthcare workers to even lay hands on medical face mask. Okay? So it would have brought competition, undue competition. People who have money would have probably bought them from the shelves in such a way that people who are in the front line that may be critically in need of them may not be able to lay their hands on them. Okay, so as a result of that, government was pushing for use of non-medical face masks so that at least we could have supplies that could help people who are saving our lives. But that may not hold true for today because the face masks are everywhere. In fact, they're like pure water now. I'm permitted to use that one. So anybody, anywhere can lay hands on face masks. We see people, hawkers selling them on our streets, on the roads. Okay, so you can, whichever one you think can save your purpose. However, there are some conditions where you will need, even as a non-medical person, to wear a medical face mask. If you have a confirmed positive person living, because these days we are talking about home-based management for COVID-19. A lot of people who are infected are in their houses. So if you have an infected person around you, you must drop the cloth face mask and switch over to the medical face mask anytime you're coming in contact with such an individual. The modalities of home care management have been clearly spelled out on NCDC website. So anybody who is interested can go and read them up. Now, it is also advisable that people who are advanced, the elderly, okay, should also wear medical face mask and not cloth face mask. Okay. So vulnerable group of persons should wear medical face masks and not cloth face masks.
Okay. Doctor, is it possible for somebody to come down with the virus a second time, even after treated?
Yes, the question has been on and on. I've gotten that question in a number. I've also seen other healthcare professionals being asked the same question. It is possible for people to be reinfected the second time. It has been proven. Okay, a number of studies are ongoing. Okay, but the good thing about the few of the studies that I came across or that I read was that those people that were infected the second time, they discovered they were not contagious. Don't forget, this is an uncharted territory. Okay. Nobody knows it all when it comes to COVID-19. So there's still a lot to be discovered. And these are discovered almost on daily and weekly basis. So we keep readjusting our lives, our way of socializing with the new information are made available to us.
Okay. Just to know though. Oh, doctor, you're not going for break. You have Charles. Charles, good morning.
Adamawa. Good morning, Charles.
Hello.
Hello, we can hear you loud and clear.
Yes, good morning.
Yeah, good morning, sir.
Yes, I wanted to know what's the place of use of maybe fresh vegetables and fruits in the fight of viruses.
The place of vegetables and fruits.
19.
In fighting COVID-19.
Thank you very much. Essentially, I think what he wants to point out is eating. What is the place of diet generally in COVID-19? Okay. Now, talking about fruits, we do know that fruits and vegetables are very healthy food sources. And of course, a good number of them, we can derive a good number of nutrients from those. We can derive a good number of nutrients from such foods. But essentially, what we advise is for people to eat a balanced diet, okay, that will offer all the major nutrients that the body requires to keep going, okay? It could be fruits, it could be any other food, okay? But whatever you do, it should be done in moderation.
Okay, doctor, some people even also believe, say, this school of thought that cold, they also influence the infection. I don't know, how true is that? Because now they see people, they will just tell you they don't stand under the sun because they need heat, that it helps in fighting COVID-19. I don't know how true. But then we are just open to different myths these days because of the whole pandemic. So, well, really, does it help? Or, I don't know, cold and heat right now?
No. That has been debunked. You know, at the beginning, there were a lot of issues. There were a whole lot of issues. Okay, but nobody should be blamed because people wanted. It was a huge crisis.
Some people took salt and water.
Yes, it's still a big crisis. The world is still in the middle of a pandemic. We're still fighting a big crisis. So anything at all that anybody could be touted as a solution, people will hop on it. Okay, don't forget that we had the same issue with COVID-19. With COVID organics, I beg your pardon. Okay. Talking about the Madagascar supplement.
Okay, so really, does it...
We have...
you have a doctor.
Dr. Tijani. Good morning, sir.
Good morning.
Doctor, good morning, you.
Good morning.
Good morning. Please go on.
Please, is there a lot of causes the fruit?
Fruit?
We didn't get your question, sir.
I think it's gone. It's gone.
I think he mentioned fruits.
I heard fruits, though.
Yeah, some fruits are actually sources of some vitamins, okay? Like vitamin C can be gotten from a number of fruits, okay? Ascorbic acid can be gotten from fruits like oranges. Now, vitamin C are one of the important nutrients that the body requires. It serves as an antioxidant, okay? Aside vitamin C, you also have other important vitamins that the body can benefit from at a time like this, talking about zinc, talking about vitamin D that we mentioned before now. Okay, so fruits can actually help.
Which of the vitamins do we need more, doctor, right now?
We need all of them. There's no specific one that we need more, but we pay more attention on I think about 3 or 4 of them: vitamin C, vitamin D, zinc, and of course, all of these are helping. Okay, in trying to strengthen our immunity. So I was talking about some of the attempts that were made at the initial time, and then of course I remember the COVID organics, the drug, the Madagascar supplement that was touted to be helpful at the initial stage. I have a special interest on the Madagascar COVID organics, but it has been completely dealt with. Of course, the studies that was carried out in Nigeria has shown that in strong doses, it can act as a very good cough suppressant. Okay, other than that, it has been proven that it has no efficacy. But a lot of people, Madagascans that took to the drugs at that time, a good number of them, because they were actually in 2 doses, said to be prophylactic. The A part was said to be preventive, while the second one was said to be curative. As we speak, Madagascar has climbed to 11th position in Africa with an affectation of about 12,708 persons. In the last 24 hours, they have 182 new cases. Okay, so just so you know, what we are concentrating on is the non-pharmacological interventions, the face mask.
We'll continue next week. Thank you
very much
for watching.